to its lower risk travel list. And here to discuss it with us is Dr. Shira Doron, hospital epidemiologist at Tufts Medical Center. Thanks for being here.
Sure.
So one of these states, New Jersey, was on the list 2 weeks ago. Then it was off. Now it's back on. It feels a little confusing. Is travel there really safer now than it was last week?
Well, probably not. You know, numbers fluctuate a lot from day to day and week to week due to a variety of factors. And as a result, another change that we're going to see starting tomorrow is that a state will need to have data that put it in that higher risk category for at least 2 weeks, not just 1 week, to be moved from low risk to high risk. And they've also increased the case number criterion from 6 cases per 100,000 to 10 to qualify as high risk. And I wouldn't be surprised if we see more changes to that strategy, because as Massachusetts cases rise, we're already very close to meeting that definition of a high risk state.
It feels like more data will give us that bigger picture. Speaking of data here, the U.S. just passed 60,000 new cases in a single day. That's for the first time since August 14th. Today, Massachusetts saw its highest positivity rate since June. What is concerning you most right now about these national and local numbers?
Well, there's a lot that concerns me, but it's not strictly the numbers themselves. We know that we will see case numbers rise as we increase testing capacity across the country. But what worries me is that we're seeing hospitalizations rise across the country. Some states reporting their ICUs and hospital beds are full. And when that happens, it's not just COVID-19 patients that can't get care. It's everyone who needs medical care of any kind, meaning elective procedures and visits canceled. And that has a prolonged effect on public health.
Make prevention become so much more important. The New Hampshire governor just announced that he's shutting down skating rinks for 2 weeks to take a look at safety protocols. Rinks seem really big. So how did hockey become so high risk?
Well, coincidentally, today the CDC published a case study about an outbreak of COVID-19 in 2 hockey teams in Florida who played together while one player was in the contagious period 1 day before symptoms developed. And they pointed out that hockey is a close contact indoor sport with a lot of exertion and huffing and puffing for transmission, especially if masks aren't worn.
Right. All right. So the size of the space may not matter as much as what's happening in it. Okay.
Yes.
Dr. Doron, thank you so much for your time. We really appreciate it.
Sure. Thank you.